Faith-based radio.
Welcome. We're really thrilled to have Commissioner of Immigrant Affairs, Fatima Shama, who will brief you all on the city's response and next steps regarding Hurricane Superstorm Sandy, specifically how it impacts immigrant communities that many of you cover. We'll start 15 minutes presentation, and we'll leave the rest of the time for your questions and answers. Thank you. Commissioner Shama?
Hi. Good afternoon. Hope everyone's well. Happy New Year. This is a chance, actually. So first I want to say thank you to our colleagues at the CUNY J School, Sarah and Gary, who are such great colleagues, and to all of you for coming out to be a part of the conversation. This is really a great chance for us to make sure that we continue to connect with all of you, and certainly the communities you're writing to and for, because as many things happen, but in particular around Hurricane Sandy, many of the communities around the city, and certainly our immigrant communities, were impacted greatly. And so today's a chance for us to share with you a number of things that the city did in response. Many of you reported actually on the city's continued efforts, but in addition, to talk about how all of the work that we've been engaged in leads us to what we're announcing today. Okay. And so we're gonna talk, and then we should have a nice Q&A. I do want to just say today's conversation really is about the hurricane, and so we're going to limit the discussion to that. Thanks. Okay, so as many of you know, the hurricane hit the city the week of October 29th, and the city, the mayor, and through his leadership, did a tremendous number of things in the city to make sure that we as New Yorkers were prepared. Certainly, immigrant New Yorkers got a lot of messaging. We were working diligently to get messaging out in a number of languages, but still, you are incredibly critical through that process. It's important to know how much this was a hurricane that had a magnitude the city has never seen before, and we continue to realize different impacts and devastations of what that reality is. But so by way of background, the city opened up more than 60 evacuation shelters. We had disaster assistance service centers around the city. We then opened restoration centers, which are still actually opened in the impacted areas. We had 200 warming centers because we were in communities that were impacted. We needed to make sure that our New Yorkers were safe and well, and so we had warming centers. The city distributed more than 2 million meals during this period, over 700,000 bottles of water, over 200,000 blankets, and thousands of other supplies. You can visit some places still, and you will find that the supplies have changed. Now you might find that people have masks and different gloves because of mold remediation and mold removal, but the city continues to be very active in responding to what the needs are in our communities. Again, I think it's really important to note that this was something many of us, and I'm a born and raised New Yorker, we'd never seen before, right? This was a magnitude of a devastation in a city. And like many of the FEMA workers who came would say to us, this was something they'd never seen before, right? Hurricane Katrina was something people kept reflecting. New York is very different, and we live in buildings, as people noted, on top of each other. Our language and cultural diversity is something many federal workers have never seen before. And so it's actually through partnerships with community-based providers, through faith-based organizations, that were really critical for us getting information out there. Our office was very in great contact with both faith-based leaders and community-based leaders. We had several conference calls to make sure we were updating our colleagues. My entire office and our team, we were on the ground immediately, and we were on the ground for about 3 to 4 weeks through the process, working on projects that were bettering the lives of immigrants, but really bettering the lives of all New Yorkers, including our immigrant New Yorkers. We were doing translations like crazy, but as needed and critically important. And I think one of the things that resulted from what we learned was actually coming together with the New York Immigration Coalition and hosting a conference at Baruch for community service providers and really talking about what those needs were. The evolution continued, we are now at a stage of really knowing, as we think about the rebuilding of the city, what do we need to do, and what do we need to do to ensure that immigrant New Yorkers are not left out. We know, we are very aware of the reality of what aid has meant, right? What FEMA aid has meant, what federal, state, and local aid has meant. We worked actually with a Buddhist foundation, the Tucci Foundation, and secured $1.2 million specifically for immigrant households that were ineligible for any other forms of aid, and have have partnered with community-based providers to make sure that money gets into the hands of those households. That actually is a process that is evolving and continues to happen. But we are now at a stage and are able to announce actually that starting next week, we will have immigrant outreach workers in communities surveying our immigrant families and their households. We know that many have been unable or have, for lots of reasons, not come forward for aid. We actually know that many have, and now are getting denials from FEMA. We know that people may be living in homes that need remediation, have mold, but more than anything, we actually are hearing this anecdotally, right? We're hearing it as stories. We actually need to know the facts, because as a city that has to rebuild itself and has to include the immigrant communities to rebuild itself, we need to know the facts to make sure that we're doing it right. So today, actually, we're really delighted to announce on behalf of the mayor that the City of New York is partnering as a result, actually, of the mayor's request, Mayor Bloomberg's requests, and his assignments to all of us to ensure that we are doing all that we can to rebuild and restore the lives of all New Yorkers. With private support from the Mayor's Fund to Advance New York City, the Mayor's Office of Immigrant Affairs, together with a great community partner and a great organization in the city, the Federation for Protestant Welfare Agencies, and actually this is a project that will be managed by the Federation for Protestant Welfare Agencies. We'll have 25 outreach workers, or more in fact, but a minimum of 25 outreach workers in our communities. These are individuals who will be multilingual, from the community, truly understanding of the cultures, that will be canvassing, right? So canvassing in the traditional sense means to knock on the door and to ask a number of questions. But what we want to know, really, from our households is what's going on today and what's going to be needed for the next 22 to 24 months. Because as the city continues to think about its strategy, we want to make sure that we capture what those needs are. Everything from your permanent structure of a home, educational, have the kids been moved because the house has been ruined and now kids are in a new school, and what's that meaning for the family and their children? Food, has this family been able to get all that they needed, whether it was from disaster food stamps, or are they in need of additional food? So is food a question? Is health a question? Is there mold in the house? Are folks too afraid to come forward, and as a result, still with wet and damp things in the home? The city is working with the state to coordinate long-term disaster case management. We know that there are going to be a number of organizations that can provide social services over 22 months. Are these families people we need to make sure get those services? Are some of the families we meet in need of emergency cash assistance, and how do we make sure we connect them to those services? So this is really about meeting each of our immigrant households where they're most comfortable, which is in their communities, and speaking to them in their languages, and really assessing from them what are their needs right now, and how do we estimate what their needs are over the long term, so that as we, the city, are rebuilding and putting together our overall plan, our immigrant community is included in that plan. And so I can speak specifically about any number of things, but I think what we need your help with more than ever is to make sure that as we go into communities, that they know we are there to help them. And it literally will be community members from their communities, people who speak their languages. And so it's going to be a process. We're going to be doing this for 8 weeks. Our hope is that at the end of 8 weeks, we would have reached approximately 6,000 households, and that will give us, and the languages and the neighborhoods are what we know to be the impact zone. So in Queens, it's the entire Rockaway Peninsula, and concentrated in neighborhoods that of course have, that we have basically learned from many of our partners on the ground, have the greatest concentration of where immigrants are, so that we can ensure that we connect with them. In Brooklyn, it's the southern Brooklyn, Manhattan Beach, Garrettson, Brighton Beach, Coney Island, that entire southern Brooklyn neighborhood. And then in Staten Island, it actually covers a pretty good swath of both Midland Beach, but as well as some of the families that have been impacted as a result of a number of areas within Staten Island. So those are the 3 key areas and target areas we're working in. And together with the Federation for Protestant Welfare Agencies, we're excited to be able to announce this, and through the support actually of the Mayor's Fund, which is really important. So, happy to take some questions and talk more actually, and specifically if you'd like. Yes?
Okay. You talked about the present situation, right? Because the governor said, it's a reality because the global warming and climate change, this thing could happen again. So what is the future? If anything happens next year or after a couple of months, this could happen. What is the future?
So I mean, I think that as the city continues to rebuild itself, there's a number of people thinking about, what does that look like? And I think for us, certainly, it actually talks about what does a communications plan look like to make sure that we are thinking about how do we reach immigrant households as quickly as possible. It probably means how do we think about using ethnic media in a much more robust way. From a scientific perspective, there are people who are doing that kind of work, right? And we certainly, what I want to make sure we're doing is capturing the data of where our immigrant communities are, what their challenges have been, and how do we ensure that if ever this happens again, we know that they're there. I mean, I think that actually was part of the reality from what we learned in some parts of the Rockaways, right? Many people didn't even know that there were immigrants in concentration in some parts of the Rockaways, right? And so we now need to know that, because we can't ever have this happen again and us not reach people as quickly as we need to. Yeah.
What would it need to qualify? Obviously, if you're looking at immigrants, startups would be one of those questions, and if that's a question, how much would people be willing to be open about it?
That's a great question. So what the real point here is we're working with a community-based provider who will be capturing all of this information. In the city, I've said this before, I'm happy to say it again, we have a commitment to ensuring confidentiality of every single New Yorker's information, including immigration status. So this information is not being shared with anyone. And it isn't, we want to know what people are eligible for, we want to know what they've been ineligible for. We have a good sense when someone can disclose or tell us whether they've applied for FEMA or they haven't, and why. I don't know if we're going to deduce whether people are undocumented. We don't want people to be afraid of telling us information. We need to make sure that if they, a lot of the rebuilding and aid has been aligned to FEMA registration numbers, right? So many of our families are going to be left out of housing opportunities. We can't allow that to be the reality. Right? My colleagues and I, the mayor, will not allow that. Mayor Bloomberg will not allow that to be the reality. And so we're going to do this to make sure that we get the right information so that we know who we're talking about in the broadest sense of what we mean when we say New York. I think it's important to say we have a commitment to protecting every New Yorker. Certainly at this time, right, we're going to really assess their needs. And so we're not interested, this is New York City's commitment. We have no relationship or partnership with any other entity, right? This is not a city, state, federal partnership. This is New York City alone, and New York City is held by Executive Order 3441 which actually means we maintain people's immigration status as confidential, so folks don't need to worry. The other thing that I think is more important than that is that we're working with a really trusted, great organization, Federation for Protestant Welfare Agencies, and they are going to help maintain that this information is maintained confidential with community partners. So we need your help actually to make sure people know this is about taking care of them. Yeah.
Will there be any similar initiatives for immigrant-owned businesses?
Yeah, it's a great question. We're actually trying to figure out how do we, in the process of canvassing, get to those immigrant-owned businesses. We've heard from several groups that this is a real reality, how many have actually applied or come forth for SBA loans or any other form of assistance, or are just sort of winging it. And I think we're trying to figure that out. This is not an audience we have forgotten, so I'm glad you raised that question for us. So to be continued.
So if someone is undocumented, he is the owner of the house, they are eligible to apply for FEMA assistance?
No, actually, unless they have someone in the household who has a U.S. citizen, a Social Security number. Actually, you don't even have, if you have a Social Security number in the household, that household can apply for FEMA assistance. The deadline is January 28th, however, right? Which is why, for us, it's really critical that we get out as quickly as possible and that you help us actually make sure people understand. For FEMA eligibility, if you have a Social Security number in your household, you can actually apply for FEMA assistance. If a family is denied, the City of New York is now ramping up a legal services initiative that will help be able to respond to those denial process, which will actually be available through our network, right? So the outreach workers are going to be part of a larger audience that will be able to utilize that larger network of referral services. But as January 28th gets closer, we get more nervous about making sure we reach people. And as people start to get denial letters, they start to basically throw them away, where we want them to tell us so that we can help figure out, are they really eligible? Was this an appropriate denial? So there's a question in the back.
In what way your office is going to help the small businesses? As you were saying about that you are working on Coney Island and Brighton Beach areas, but I interviewed a lot of people over there, a couple dozen. So they said nobody from your office and from city help them. So nobody reached to them.
Well, so the city's Department of Small Business Services and the city's Economic Development Corporation have actually done some really robust work in getting into communities that have been impacted. At this point, there are loans eligible for small businesses that the city's Department of Small Business Services is overseeing, for small businesses that were impacted and needed to relocate for some reason. Our department, or our Economic Development Corporation, identified several warehouses where people could move and utilize that space for free. I think what we want to really understand is, for immigrant small business owners, how many of them still continue to struggle, and how do we help get them additional resources or information? Because the FEMA opportunity is one for them to think about, but it's also the Small Business Administration, what services can be provided on the federal level, but on the state level as well. The state has been doing some really great work on the small business space. But our colleagues in the city, from the city's Department of Small Business Services and the city's Economic Development Corporation, have been doing a lot. There are grants available through the Mayor's Fund for small business providers, and so we can make sure that you get all of that as well. Yeah.
As far as the city is aware, what is the health situation in the Rockaways overall? And is the city considering reopening Peninsula Hospital? It's the only public hospital in the Rockaways. It was closed.
It's not a public hospital.
It's closed in April.
But it's not a public hospital, so it's a difference.
Okay, well, the city closed it down in April. Is the city considering reopening it?
The state closed it down in April, and it's important to know, Adabo Health Center is still functional in the Rockaways. There are in fact a couple of institutions that continue to work. I don't know the current status of health in the Rockaways. There's a tremendous amount of work that the city's Department of Health is doing around mold remediation in particular, and information. We know we've been working closely with a number of faith-based organizations that are doing a lot of good information dissemination to members of the Rockaway community. But the Rockaways, the city has been working very strongly in the Rockaways, putting together, in fact, a coalition of organizations that will continue to work. Right now, there's a coordinator that has been funded actually through the Mayor's Fund as well to be on the Rockaways working, identifying imminent needs and how do we respond to them. So, yeah.
I have a few very specific questions. Number one, as it applies to canvassing. Well, first, just about the public health situation in the Rockaways. I've been on the ground for the last 11 weeks in the Rockaways, and actually the Department of Health's response to mold has been woefully inadequate, and specifically for the immigrant population. The Department of Health up to a few weeks ago was actually just trying to get a handle on how to deal with the mold situation. So it's mostly been faith-based organizations and VOADs on the ground who've been dealing with the dissemination of information on mold. And almost none of those materials are translated into Spanish, which is definitely a problem. In terms of canvassing, I have a specific question about how this organization is going to be interfacing with groups on the ground. We've been doing canvassing since day one. We know where the immigrant communities are in the Rockaways. Many different organizations. Occupy Sandy has been on the ground since day one. We have a really good, I'm an Occupy Sandy member, we have a really good grasp, a firm grasp on where the immigrant populations are in the Rockaways, and we have that canvassing data. And so, we've definitely had a huge issue with organizations coming in and canvassing and then taking that data and processing it remotely and it not serving the needs of the community. So my concern, and I know that this is a concern that many of us have, is that this whole new canvassing process will start, and in the meantime, we're finding all these families that are falling through the cracks. As you know, Make the Road New York put out a great study. Upwards of 60% of families, immigrant families, particularly undocumented, don't know, haven't applied for FEMA because they're living in the shadows. So how is the mayor's office planning on moving forward with interfacing, for instance, with FEMA to provide all of the FEMA representatives that we work with in our hubs, they come unprepared to deal with the immigrant population because they don't speak different languages. And so is there any plan to provide translation services? Is there any plan to disseminate this information about the deadlines to the immigrant communities? And are there any plans specifically to work with organizations on the ground who have done canvassing so that we can work together? We can work together and kind of expedite this process so we don't go weeks and weeks and weeks.
Yeah. So let me start at the very top, which is the reason we're talking to all of you today is largely because we want to make sure that you help us inform the immigrant communities about January 28th and the importance of making sure our communities know about this, right? Secondly, around interfacing with folks on the ground, the entire focus of this is actually working with an organization that will work with community-based providers that are literally in the communities on the ground doing this work, and that have been doing this work, right? And so I think it's actually really helpful to have you here, but also to just make sure we talk to you a little after and just hear a little bit about your experiences. And I think as we think creatively about how do we dispatch teams on the ground, we want to utilize some sort of really smart human capital that's on the ground. So it is really community-based providers on the ground that are doing this, right? So that are being that know their communities really well, and we're trusting them to work with us to help this done, to help get this done. I think you raised a good question about, so what does it mean around all this data? And sort of, I think it's important to understand. I don't know everyone who's been canvassing, and I know we, the City of New York, have been canvassing for a lot of reasons. First, it concerns me that you're saying there isn't mold information available in Spanish, because I know I've seen it in Spanish. So let's make sure you get it, because we made sure that it was available in several languages. So let's make sure you get it, one. Second is, the city's been canvassing for health issues. It's been canvassing to make sure that if people are living in homes that have no heat, we are connecting them to either understanding that there are housing opportunities available for them, or in fact that they're getting some form of a resource to keep them warm. But our effort really is focused on understanding, to your point, the fact that there are homes and families that are in the shadows. And I've spent a good amount of time talking with providers, and in fact, right, on the ground. I've been on the ground probably in a couple of weeks, but continue to do our sort of site visits out into communities. And this work never can get done without partners, right? And so partnership matters, and our faith-based and community-based providers really are our partners in this work and have helped really inform us, including folks like Make the Road New York, about what's happening. And so this is really about how do we get to those folks who actually are really fearful of talking, but we can't let them not tell us their story, because then they're not part of the solution. And so we need to ensure that our immigrant communities are in fact part of the solution. And so I do in fact encourage you, I'd love to talk to you after, and I'm sure that our colleagues from FPWA, Rev Gibson, would love to connect with you as well. So let's make sure we do that. Yeah.
What might be the result of this initiative? Would there be a report you are going to release next month, so you are going to deliver any funding to those students?
So we have 8 weeks. We're committing to doing this for 8 weeks, and my hope would be that we would in fact have something to say, and more than that, have something to say about it, right? So here, we found 2,000 families that have, are ineligible for any other forms of aid, and how any number of wonderful funders we're going to approach are going to help us make sure those families have, housing, cash assistance, or, if there's mental health realities, ensuring that we connect X number of people to those services. So in 8 weeks, my hope is we can have a conversation again about what it is we learned from this opportunity on the ground.
Another question on small business owners. From our experience of dealing with these small business owners who are impacted in this end, one of their biggest concern is the loan. The loan they apply for from the SBA or from the city was processed very slowly, more than 3 weeks. Some of them haven't got any penny from SBA yet, but some local communities, they are providing the loans like for 3 days from you apply for it to the day you get the check. So, but the SBA is federal level, so what city agency?
We can actually have a conversation with the feds, but it's nothing we can do much of, which is actually why the Mayor's Fund worked with our Department of Small Business Services to make sure that a loan was available so that we can turnkey their grants that are available, so that we can make sure that small business providers have access to capital fast. We should make sure you get that information.
But that grant is very tricky. The grant is not given to every small business owner or who apply for the grant. They have to apply for the loan first, and then they can get the grant.
They have to apply for the SBA loan first?
No, the city's loan.
The city's loan,
Then
okay.
they get the grant. So it's not very practical to all the impacted owners.
So I have to admit that I don't know the specifics of it, but I'm happy to look at it, and then we should talk to you specifically. Or in fact, I think the question that gets raised here is, how do we ensure our immigrant small business owners are getting access to this information? And we've done some really good work with a number of immigrant small business providers and associations. I think this helps us realize we need to make sure that we don't forget that audience and make sure we're pushing information out into them as well. So we should make sure that we have your card so that we can get some information to you. Okay? Yes, and then, yeah.
Yeah, thank you for sharing all this information. As a part of the Hispanic media, specifically, I would like to ask you, you mentioned that the mayor's office is putting together a coalition of organizations. So I would like to know about the response of the Hispanic organizations, and also the work of the Hispanic consulates, if there is one. And can you mention some of the organizations, Hispanic organizations that are involved in this project?
Sure. So the first question of, so there, in every impacted area, there have been lots of groups that have come together to do lots of things, sort of as this young woman shared, that are on the ground doing lots of things. And I think what we, from the city's perspective, is realizing that a lot of this rebuilding and continued energy has to be community owned. And so we didn't organize per se, other than we have been happy to utilize funding from the Mayor's Fund to provide an opportunity for a coordinator to work with those groups on the ground. So in Queens, there's a sort of coalition of groups in the Rockaways that have been working together, and I believe that SEO Family Services is the lead organization. In Coney Island, it's Metropolitan Council on Jewish Poverty that's become the sort of lead coordinating entity, but they are bringing members of the community groups together that are working together towards many solutions. And then in Staten Island the same, and I believe it's Catholic Charities that has been identified as a lead provider that's convening folks in all three of those impacted areas. The third question you asked about Hispanic organizations. So in this initiative in particular, in Staten Island, we are working with El Centro del Immigrante and Project Hospitality. In Coney Island, we're working with, right at this point, Shorefront Y and COPO, the Council of People's Organizations, and in the Rockaways, Queens Congregations United for Action and Committee for Hispanic Children and Families are the 6 organizations that have been identified at this point that are going to be helping us with efforts on the ground. The additional point you made was around consulates. I can't really speak to what consulates have been doing on the ground. The one consulate we know, as a result of conversations we've had with them, is the Mexican consulate, and the tremendously rich work that they've been doing, even actually in assisting us to make sure that Mexican families that have been impacted are getting access to resources. They've just done an outstanding job on the ground.
I made a question because there are a lot of big Hispanic organizations. They are always present at the parades, and when the community needs the assistance, I don't know how they are responding. So that was the curiosity that I had.
Yeah.
Thank you.
You're welcome.
It's good to know.
Yes.
Thank you, Commissioner. I have 2 questions.
Sure.
The first, can you go back and clarify what happens when FEMA rejects a claim, and after that February or that January 28th deadline, what the process will be? And the second question I have is there an advertising budget or to help you all deliver your messages?
So the first question is, January 28th is the deadline. So the deadline to apply for FEMA assistance. It is not the deadline to appeal, right? So once people get denial letters, and the process for why FEMA would or wouldn't provide assistance is not anything I'm very familiar with. But if someone gets denied, we do in fact want to encourage them to seek some legal assistance or guidance, or even approach FEMA, since they're currently still in New York City and will be here, and ask why. They have a right to do that, and FEMA has told us that they stay around to make sure that they can respond to people's denial questions and requests. So we want to make sure that anybody who can be eligible for FEMA assistance does apply by January 28th, which is that deadline. We understand they stay 90 days after. That's at least what I understand. FEMA will stay present in New York City 90 days after. That hasn't been confirmed all the way up, but that's what some local folks have told us. We are certainly trying to make sure we have a robust legal services initiative on the ground that can have a multilingual, robust legal services initiative that can respond to helping people be able to question some of those denials or go through the appeals process fairly comfortably. So that was the first question.
And how do they access it? Where is that go-to office or that?
So there's, right now we really want people to utilize the restoration centers that are currently around the city. And there is one in Staten Island, one in Coney Island, and 3 on the Rockaways, and I've got the address of all 3. That is where we are trying to ensure that people go for assistance. There are community-based providers nestled with city agencies to be able to provide referral services. Every Thursday and Saturday, pro bono attorneys have been at each of those sites providing assistance and counsel on the appeals process. Okay, there will be a hotline number, but that funding hasn't been confirmed yet, but we're sort of advocating for that. And your second question was about advertising. So we do have advertising dollars to work with all of you on getting a message out there. FPWA will be managing that process as the intermediary organization, and we really work strongly with our colleagues here at CUNY J School to think through some of the best strategies. And so we look forward actually to being able to get messages out into our communities through ad dollars, through actual paid ads. But I'll take your stories too.
Any idea how many immigrants affected by this?
Where's Dan? What was the number that we had come up with, Dan?
So
Up to 60,000 live in those areas. And this is based on, our Department of City Planning was running a number of data sets based on zip codes that have been impacted. And so it's up to 60,000 immigrants have been impacted in the zones.
So out of how many people altogether?
You know, that's a really, that's a great question. So in the sense of the universe, I don't know the actual number, but this is a devastation that I think continues to surprise us in how it's impacted people. So, yeah.
Any idea what the timeline is going to be for not only the canvassing, but the case management, more importantly?
For us, the sort of outreach worker process is 8 weeks. There is a funded long-term case management initiative that's being funded actually through the state, but that we'll have going live in New York, in the city, and that's 22 months, right? So, and it's being phased in. So I think there may be a couple of agencies that might have been informed now that they are starting case management, but that's over a 22-month period. That those long-term disaster case managers will be alive and sort of funded.
And they're interfacing with FEMA?
Yes and no. They're actually really focused on, in some instances, yes. And in some instances, it really is about the individual and the household and making sure that from a long-term perspective, we're able to really respond to those needs. And we were very lucky to be able to advocate to make sure that a lot of the community-based providers did, in fact, become part of that disaster case management assistance to recognize the linguistic and cultural needs that the city's communities need. Yeah?
I'm sorry, I totally missed something. So this is particularly a data gathering process with a little bit of case management.
So
I have a second question.
Yeah.
What about those immigrants who don't own businesses or own homes, but renting and...
Yeah, we want to know who they are. Yeah. This is really about making sure, you can tell me today, Fatima, we know X, Y, and Z is happening. And I would say, I need to know more than that, right? No funder is going to give me $5 million to invest in something without having a real understanding of what those needs are. And so we need to, there are people doing lots of canvassing, right? And the National Guard has been here doing lots of canvassing. We really know, from many of us who've worked in communities, that interfacing with your community actually is one of the greatest ways to help ensure that we're getting the right information. And so this is about getting information. It is about making sure we're referring people to the right services and that no one is forgotten, certainly not in our immigrant communities. Because the only way we can come up with a solution is when we fundamentally understand the problem. And by just saying we know the problem isn't enough, right? We're competing for resources, and we need to compete. And so I'm going to fight for the money for our communities, but I need to be able to show what our communities really need. And it might be, right, for years, people talk to us about their health needs as a result of 9/11. We need to actually know that now, so that we're planning for what their health needs might be as a result of mold or anything else in 7 to 8 months, right? That needs to be part of a plan. And so we want to put that plan together, but we need to have that information. And we need to really understand it from our communities. Yeah?
Isn't this work, when I hear all of this, isn't this work that perhaps the city and FEMA and state should have taken care of in terms of reaching out to these immigrant communities?
So this is an evolution. I mean, we've been engaged in this work from the very first day, right? We have been talking to people from the very first day. And the reality is that it is a continuous conversation that we have with communities. For me, this is, as we continue to put together plans for the long term, right? We learned immediately people had unmet needs. So we started to figure out ways that we can get cash into the hands of individuals, and we were able to secure $1.2 million to make sure that it got into the hands of individuals who were ineligible for any other forms of aid. And we're committed to continue to do that. The City of New York, the mayor is committed to continuing to do that, right? In this city, we celebrate the fact that every New Yorker is a New Yorker, irrespective of status. With that said, there are things that are going to make people ineligible for federal benefits. And so we need to figure out, from the long term, what those needs are and how do we respond to them. So this, we have been a part of a conversation and have been doing things from the very first day, whether it's giving out food and blankets, reaching out to communities, partnering with consulates to make sure we were reaching people who were hard to reach, working with community-based providers, working with faith-based organizations, talking to the faith-based organizations. It's been a constant conversation. And I think we're at this point of really going in and really getting more of that feedback so that it's actually part of the strategy for what happens next in the city.
Thank you.
Great, thank you.
Thanks, Commissioner Shama. Right now, this is the end of the official news conference.
Carry Voice Radio.